Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Campus Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we will talk about the topic synovial joint. So first are the classification. So first classification is plain synovial joint. So in this, articular surface are more or less flat, that is plane, and plane synovial joint permit gliding movement in various direction. Examples are intercarpus and intertarsal joint between articular process of vertebrae, superior tibiofibular joint, intermetacarpal and intermetatarsal joint. Next is tarsometatarsal joint. This figure represents the wrist joint, in which these are the carpus present in the hand, and between the carpus there is a plain synovial joint. Next type is hinge joint. In this, articular surface are the pulley shaped, and the hinge joint stability is provided by the strong collateral ligament, and the movement is permitted in one plane around a transverse axis. Examples are interphalangeal joints, elbow joint, ankle joint. This is the example of the elbow joint, which is a joint between the humerus, radius and ulna bone. Next is pivot or trochoid joint. In this, articular surfaces comprise a central body pivot, that is peg, surrounded by an osteoligamentous ring. Movements are permitted in one plane around a vertical axis. Examples are superior and inferior radioulnar joint, median atlantoaxial joint. So this is the example of the radioulnar joint. It is superior radioulnar joint. This is inferior radioulnar joint. Next is condylar or bicondylar joint. Articular surface include two distinct condyles, convex male surface fitting into reciprocally concave female surface. These joints permit movements mainly in one plane around transverse axis, but partially in another plane, rotation around a vertical axis. Examples are knee joint, right and left temporomandibular joint, that is jaw joint. This is a knee joint, which is a joint between fibula, tibia and the femur. Male knee joint is by the condyles of the femur and the tibia. Next is a temporomandibular joint. It is the head of the mandible and it is the mandibular fossa. Thank you.